Hi and welcome back to Familiar Guide. I'm Margaret Martin. I'm going to cover section 2 of the Healthy Bones, the Inside Story, the impact of exercise during and following cancer treatments. If you've missed section 1, this section is understandable without it, but you'll certainly get more information in regards to bones, bone physiology, and how we build bone. All of that is covered in section 1. Just a quick word here. Most of you who've been following my blogs know that I'm very passionate about osteoporosis and exercise, and I'm equally as passionate about the loss of bone due to cancer. However, I am less comfortable with this topic area. So if I make any errors, those of you who may be listening and knowing the topic better than myself, I apologize in advance, but the information here is as accurate as I could get and is based mainly on an article that you'll see referenced, and that's a very recent 2017 article. So today's agenda, covering section 2, is the considerations of exercise in cancer care, contraindications and precautions, getting started in exercise, and lastly, exercise guidelines. So, what are some of the exercise considerations when it comes to cancer care? So we will be covering these areas, and that is surgery, lymphedema following surgery, radiotherapy-induced heart disease, chemotherapy-induced pathology, cancer-related fatigue, cancer-induced peripheral neuropathy, and metabolic disturbances. So let's cover each one. Surgical treatments may be indicated either at the time of the initial diagnosis, such as a biopsy. Surgical intervention may be very small, or can be involve a very invasive procedure. Depending on, obviously, on the surgery, there may be a period of acute rehabilitation, followed by an extended period of body reconditioning. And so that's where, insofar as surgery, the consideration does come in. There is the post-surgical lymphedema that has to be taken into consideration. That involves altering someone's body image, reducing arm function or leg function, increasing risk to secondary infections, also can be an outcome of lymphedema. And insofar as upper arm swelling, the shoulder mobility will be affected. And we know that studies have shown that stretching and resistive training assist with reducing the lymphedema and reducing the risk of obtaining a frozen shoulder. So a very important consideration. When it comes to radiotherapy, it is very commonly known that it affects the heart, and so there is a condition called radiotherapy-induced heart disease. And these are severe abnormalities of the coronary vessels, the blood vessels that feed the heart, as well as abnormalities of the pericardium valves. Radiotherapy-induced heart disease can also be measured by defects in the actual conduction of the heart and fibrosis of the heart. So the heart is less elastic, which increases the risk for arrhythmias or irregular heartbeats, I should say. Now, with radiotherapy-induced heart disease, an important factor to keep in mind here is the latency period. So someone may have recovered from their cancer, really be on with their life. Maybe they had cancer in their younger years, and 10 to 15 years later, they're following a really active lifestyle. And the radiotherapy-induced heart disease does not appear until 10 to 15 years post radiotherapy treatment. Another consideration is chemotherapy, and chemotherapy-induced pathology involves several things. One is reduction in the ejection fraction of the left ventricle. So that is the second to last chamber, but a powerful chamber to get the blood flowing through the body. And so that when that is reduced, that will certainly affect your cardiovascular function. Something as extreme as heart failure, thromboembolism, severe increase in blood pressure, and lethal or deadly arrhythmias are all part of this pathology. So needless to say, earlier the better, but early cardiac function testing is very important. And exercise should be considered as an effective cardiac protector since it has less side effects than many medications that would otherwise or could be used as a cardiac protector. Resistance exercises have been shown to reduce the dosage and the delays of chemotherapy treatments in women with breast cancer. So a real benefit being that you have that reduction in dosage and less delays. So a real plus there for resistive exercises. When it comes to cancer-related fatigue, this affects up to 80 to 90% of persons with cancer. It is more severe than what we refer to as general fatigue when people sort of say, I'm tired. But it's not the same. It's often not helped by rest or sleep. It can result in depression and lower quality of life. And we now know that it's due in part to altered metabolism from decreased circulation in the limbs and an increase in inflammation in the body. For cancer-related fatigue, other causes are numerous and should be excluded before just ruling out the fact that somebody is just experiencing cancer-related fatigue. So other causes are tumor-related electrolyte abnormalities, dehydration, loss of appetite or aversion to food, thrombosis or pulmonary embolism, renal and liver failure, adrenal fatigue and exhaustion, and neurological deficits. So all these should be ruled out as possible causes of fatigue. We know studies have shown that multimodal exercise programs, so when you're mixing up a variety of approaches to exercise, walking, restorative approaches have been shown to benefit both the fatigue and the depression that's associated with the fatigue. When it comes to cancer-induced peripheral neuropathy, so peripheral being the ends of your limbs, mainly. You'll notice this peripheral being your fingers and toes, hands and feet, that individuals receiving chemotherapy, of those 30 to 40% of them will potentially experience this cancer-induced peripheral neuropathy. So the symptoms of axonal degeneration, so where the axons of the nerves degenerate, include pain, tingling, numbness, temperature sensitivity. Also, other symptoms are impairment or loss of voluntary movement, pain from a touch that's not normally painful, muscle weakness, as well as worsening of balance, which increases the risk of falling, which is a big concern. Now, as well with cancer-induced peripheral neuropathy, it has been shown that exercise has a positive effect in reducing pain and improving physical function. There's new evidence suggesting that exercise and muscle stimulation may actually decrease the rate of degeneration of the axons. And that exercise should be targeted not only at the overall physical activity, but should also be limb specific or region specific. So if you're getting that numbness and tingling in the arms, walking, it will not be sufficient. You will want to do some upper body exercise. And in persons who have symptoms of the cancer-induced peripheral neuropathy, physical activity should incorporate exercises that increase strength and, for reasons we've mentioned above, to reduce the risk of fall. These exercises should also target at improving balance. And lastly, in exercise or cancer care considerations is metabolic disturbances. So initially, the concern is that the tumor metabolism may increase caloric needs, and that we need to address those caloric needs to offset muscle wasting, because the body will, or the tumor will actually get its calories wherever it needs to, and sometimes that is through taking the metabolism that the muscle, or the calories that the muscle would normally consume. So possible destruction of mitochondria, which are the little energy producing cells within the muscle, as well as loss of blood flow in the extremities, will affect the metabolism. The impact will mainly be seen in cardiovascular fitness and aerobic capacity. Now, here, the article that is mentioned here at the bottom by Laura Stefani, the clinical implementation of exercise guidelines for cancer patients. I do have a link in the blog post to that article, and specifically for this section on contraindications and precautions for exercise prescription, I highly recommend that you obtain that through the article. And I was able to access this article for free online. It's a great chart, and certainly a great list based on not just the topics that we've covered already, the factors related to cancer treatment, but hematological issues, musculoskeletal issues, and as an example, since this is the area that I'm most comfortable talking about on musculoskeletal, are, for instance, the contraindications to exercise, testing and training here would be extreme fatigue or muscle weakness, bone, back, or neck pain, things that might be precautions or requiring modification to or physician's approval might be pain or cramping, things that need to be investigated before green light is given for exercise. Somebody may already have osteopenia or osteoporosis, so avoiding high impact to decrease the risk of fractures. So those are the types of things that there's a whole long list under each category, goes down through all of the areas: systemic, gastrointestinal, cardiovascular, pulmonary, neurologic. And certainly if I had the diagnosis of cancer and was considering exercise in my life, or more exercise in my life, I would be walking around with this chart and checking off all of the possible contraindications and precautions before proceeding. And certainly if you're a healthcare professional working with cancer survivors, I highly encourage you to access this article as well. So in part 4, getting started. So during cancer treatment, prescriptive exercises are ideally initiated by your oncologist, but post-cancer treatment, you often will not see your oncologist on a regular basis, and so you may be getting started through the guidance of your GP or a sports medicine doctor, but because of the precautions that we talked about earlier, a standard echocardiography and stress echocardiogram should be part of the protocol to ensure that your heart is safe to start to exercise. And blood pressure monitoring and identify to allow for and to allow the healthcare provider that you're working with to identify an appropriate exercise level, intensity level for you to get started at is very important. So what are some of the things that you should be expecting in a pre-exercise medical assessment? So one of the things may include body composition, whether it's done through a DEXA, that is one way that they are now using DEXA testing is to assess very accurately body composition. Other components of the assessment should include strength, flexibility, balance, and then specific physical therapy assessments that would be based on your surgical interventions or any previous musculoskeletal problems that you might have experienced prior to or during your time with cancer. So, and part 5 here are exercise guidelines. So these guidelines were established by the American College of Sports Medicine in about 2011. And so the reason for exercise guidelines were that exercise, we know, slows down the rate of physical decline and improves day-to-day function for individuals with cancer, and has a very positive impact on quality of life. So although there is no current validated guidelines during cancer treatment, exercise is still encouraged, but the cautionary note here is to proceed with caution. There is a direct relationship between cardiovascular fitness and mortality, and cancer survivors of all cancer types and at all stages of cancer have been shown to increase aerobic capacity when given the appropriate workload. And that's really an important part, given the appropriate workload. So that's where the testing comes in. What are the guidelines specifically for aerobic exercise? Well, the starting point is dependent on current level of fitness. Aerobic activity in blocks of at least 10 minutes, preferably spread throughout the week. The recommended time for cardiovascular fitness is 150 minutes a week of moderate intensity exercise aerobic activity, or 75 minutes a week of vigorous intensity exercise. And individuals are encouraged to increase to 300 minutes a week of moderate intensity exercise, or to be as physically active as one can. When it comes to anaerobic or resistant training, the recommendations are moderate to high intensity strength training that involves all major muscle groups. But as I mentioned earlier in section 1, should be progressive and tailored to the individual. The resistive training ideally is 2 or more days per week. It can be gym or home-based. A well-rounded program should incorporate posture, mobility, isolated stability, and whole body stability, as well as balance and agility training. The strength gains that one gets through resistive training will carry over into day-to-day activities and things like gardening and picking up, your groceries from the store. Those kind of things will be made easier. A note to keep in mind here is that fibrosis from radiation and surgical complications need to be considered when the resistive training program is being established. And lastly, for flexibility, flexibility should be incorporated into a resistive training warm-up or at any time, but it's nice to incorporate into a warm-up, and it allows you to emphasize more dynamic movement. Static stretching should be saved for the end of your workout. And along with cardiovascular exercise and strength training, Flexibility will allow you to stand tall and move well. And if you are looking for a safe program, and if you have not purchased Exercise for Better Bones, I encourage you to look at and go through Exercise for Better Bones as a great foundation for an exercise program. As well, I will be shortly, as I'm speaking now, in June 2017, and I will be shortly producing a DVD that would be also an excellent add-on to anybody's program that incorporates all of the components that I spoke about. So with that, I want to thank you for tuning in and wish you healthy bones and a happy life. I'm Margaret from Miller Guide. Keep well.